Okay, moving along here, we're going to be talking about the importance of well-being for the EMT. We're going to find ourselves in some extremely stressful situations, and if situations where we have to think quickly and respond quickly, and those sort of things, and in those particular situations, we need to be both physically and mentally prepared to deal with that sort of environment. So we're going to talk about keeping yourself prepared for the demands and risks of being an EMT. And, certainly if you're not able to function for any particular reason, your patients aren't going to get the care that they need. One thing that we can do to maintain a sense of well-being in our own lives is to make sure that we maintain solid personal relationships. And, I think EMS people certainly have a tendency to associate with other EMS people, but understand there's a life outside of EMS. It's important that we have a balance between our EMS life and the life outside of EMS. Get some exercise, at least some physical activity, because we have a tendency to be dormant and not do much, and then the pager goes off and you're at a mad dash, and that's when you can get hurt. Try to get sleep, and that can be difficult if you're getting called out in the middle of the night to respond to calls and that sort of stuff. But if you're doing shift work, certainly make sure that when possible that you can get some good sleep. Eating the right foods, limit your alcohol and caffeine intake, and maintaining your vaccinations are all very important to the well-being of an EMT. Now, standard precautions are something that we can use to protect ourselves against things we can't see, these bloodborne pathogens, whether they be viruses or protozoa or fungi or bacteria. They can lead to life-threatening diseases and illnesses in EMS. And so standard precautions are something that we will talk about. Scene size up and protocols to provide information on which precautions to take should be in place. Every service should provide you with adequate standard precaution or personal protective equipment to include gloves, goggles, gowns, mask when necessary. OSHA, the Occupational Safety and Health Administration, has issued some really strict guidelines about precautions against exposure to bloodborne pathogens. As a result, every EMS provider, whether they do it or not, is required to have bloodborne pathogen training annually. That's an OSHA requirement. It's not a state requirement. It's not your service requirement. It's something that OSHA requires of anybody who's exposed to blood or body fluids. The personal protective equipment that you have available should be adequate to protect you against splash injuries to your eyes and mouth and nose, as well as protection of your uniform and your hands. If you're not sure whether you should, fully put on all your PPE because you're not sure whether this is going to be a gushing scene and lots of blood and body fluids, go ahead and put it on. You're certainly not out anything should you find yourself in that situation. So a major grinder with lots of victims, put it on. A labor and delivery, put it on. That's when you're to be likely exposed. And here's just some example of the different personal protective equipment that's out there. Again, goggles, gloves, and masks. Always have vinyl or other non-latex gloves readily available. We say non-latex because there are some people who are allergic to latex, and it's pretty hard to buy a latex glove anymore. Now, sterile surgical gloves may still be some latex, but most all your patient exam gloves are not. And it's important that we change our gloves, wash our hands before applying new gloves between every patient. Hand washing is the number one way that you can prevent the spread of germs, and it requires you vigorously rubbing your hands under warm water with some soap for at least 20 seconds, getting all the nooks and crannies and parts of your hands. You can use alcohol-based hand cleaners when water and soap isn't available, but as soon as you get around water and soap, you should use water and soap in order to clean your hands. For eye and face protection, you want to wear some sort of face shield that would prevent splashing or spattering or the spraying of fluids in your face, because those pathogens could get in through your eyes or your mouth if fluid gets in your mouth. It should have a guard in the front as well as on the sides. Masks, we certainly can wear masks for fluid splatter, but we wear specialized masks like N95s or high-efficiency particular air respirators approved by NIOSH when we're dealing with measles, tuberculosis, SARS, MERS, those sort of infectious diseases. So here's just a good example of an EMT who's, he's got the gloves, he's got eye and mouth protection when he's dealing with a patient who's vomiting and he's having to provide suction. That patient could cough, spit, spew, and get those body fluids in your on you. Now, should that get on his skin, I don't see any open wounds or things where pathogens are most likely to get into, but it still would require washing as soon as possible with soap and water. Gowns you can wear to protect your clothing and bare skin from spilled or splashed fluids. I think we saw a big increase in the use of gowns following Ebola. So we're going to look at some diseases of concern, and hepatitis B and C are probably the two hepatitises that we're concerned with. Hepatitis C is the number one cause of liver transplant or liver failure in the United States. And these are infections that cause inflammation of the liver. And remember, the liver is responsible for filtering out toxins and poisons from the blood, for helping metabolize medicines that you take. So if your liver isn't functioning, your toxins and poisons build up in your bloodstream and can cause death. Hepatitis B and C can live on surfaces in dried blood for several days, where we often think about the AIDS virus and the HIV virus, which is a relatively weak virus and only lives outside the body a couple hours. Hepatitis B is deadly. Half the people that get it die. The other half are sick for years. There is a vaccine available for hepatitis B, but don't let that give you a false sense of security. 10% of the people who take the hepatitis B vaccine do not develop antibodies, so they get no protection at all from getting the vaccine. There is a series of 3 shots, and if you've not gotten it, I would highly encourage you to do so if you're going to be around blood or body fluid. Hepatitis C, there is a cure. There's not a vaccine, but there is a cure should a person get hepatitis C. And that just came out this last year. Tuberculosis is an infection of the lungs. It is highly contagious. It is spread by airborne droplets. And if a patient coughs or hacks who has a tuberculosis in the back of your ambulance, it can if you breathe enough of the tuberculosis virus in, you can develop tuberculosis yourself. We don't remember the outbreaks in the early 40s and 50s, but they had places where they kept tuberculosis patients isolated from the general population in the United States just because it was so highly contagious. HIV, the human immunodeficiency virus, attacks the immune system, leaving you unable to fight off infection. The disease that you get from HIV is called AIDS, acquired immune deficiency syndrome. It is a set of conditions that results when your immune system is essentially shut down by the HIV virus. Patients die from opportunistic infections that those of us who are not immunosuppressed, those of us whose immune systems are working properly, are able to ward off and fight. AIDS, the thing about AIDS is that you're at a much lower risk as a healthcare provider for getting AIDS than you are hepatitis or tuberculosis. In fact, you're 30 times more likely to get hepatitis than you are AIDS. Typically, it's contact with blood is the usual route of infection, and the blood has to get into a mucous membrane, into an open wound, or injected. If there's blood on a sharp piece of metal and that metal cuts you, or if you're around needles that have been in a body and now you get poked with them, those sort of things is typically how that virus spreads. Ebola is something that we saw a lot of last year. There were a few people in the United States that were infected. Some did die. Ebola is a hemorrhagic fever. It has a very, very high death rate just because there's no treatment for it. If your immune system is healthy, if you're able to stay hydrated and not develop the hemorrhagic part of the fever, you might be able to survive Ebola. We've not heard a lot about it in 2015. It's not gone away. It just is being better cared for. Severe acute respiratory syndrome, or SARS, is spread by respiratory droplets, coughing, that sort of stuff as well. And it's something that we see primarily in Canada and in Asia. We've not had a lot of SARS here in the United States. And then something that's new and emerging as far as respiratory diseases is MERS, which is the Middle Eastern Respiratory Syndrome, found primarily on the Arabian Peninsula, but can make its way into the United States. I'm not aware of any MERS patient as of yet here in Iowa. The avian flu, which is found in poultry, it can affect humans, but it's not very easily transmitted from human to human. That was to be the pandemic probably a decade ago, the bird flu, when it started to surface in humans who handled birds, again in Asia. And the reason that it was to be a pandemic is that if this virus that poultry can pass on to humans was able to pass from human to human, we don't have any treatment for it. And much like Ebola, it would be devastating if it could be easily transmittable from human to human. Influenza has been around for hundreds of years. That's more commonly called the flu. And when we think about the flu, we're not talking about abdominal pain, diarrhea, that sort of thing. This is a respiratory infection that leads to a pneumonia. In 1918, the influenza pandemic killed between 30 and 50 million people worldwide. And that was probably the worst. And again, the reason for that many dead people had a lot to do with we didn't have antibiotics, we didn't have antivirals, we didn't have access to health care. So it was devastating. In the United States, it kills a lot of people every fall. In Iowa, it claims about 1,200 lives every season. As far as infection control and the law goes, EMS personnel and other healthcare workers are at high risk of coming into contact with infectious diseases. And you have to have workplace safety. They have specific names for them that OSHA has given these types of policies and procedures, as well as workplace practices to include things like sharps containers, red biohazard bags, the availability of soap and water, waterless hand cleaners, those sort of things. OSHA, the standard on bloodborne pathogen, requires infection control to be the joint responsibility of the employer and the employee. You can lead a horse to water, but you can't make him drink. I can buy all the personal protective equipment and have it readily available for you as an employee, but if you don't put it on, then it's of little benefit. Now, OSHA does require that it be a responsibility of the employer and the employee. So technically, if you have personal protective equipment that's available to you and you develop a disease, that becomes a work comp claim. And one of the things that they're going to look at is, did you use the personal protective equipment that was available to you? So it's important to use it because it protects you, but also because should you become ill and you didn't wear the personal protective equipment that was available to you, it's likely that they don't have to pay for the care that's required to make you better. And if you're doing EMS as a volunteer job, remember that many people who get these pathogens are, if they don't die, they're sick for a year, that they're not even able to work. So personal protective equipment is important. One of the OSHA standards on bloodborne pathogens is that EMS agencies have to provide bloodborne pathogen training. They have to provide personal protective equipment, and they do have to provide vaccination to employees. Whether that be free of charge or not is debatable, but if the expectation is that as an employee, volunteer or not, as an employee, if you're expected to come in contact with blood and bloodborne pathogens, then we should provide you with the vaccination. It's not mandatory that you participate in the vaccination process for bloodborne pathogens. As an example, the hepatitis B 3 shots, you're not required by law to do that. It is to be offered to you, but you can turn it down, and there are some people who can't have it based on being allergic to the contents. Every workplace, volunteer or not, has an exposure control plan that outlines what you're to do should you become exposed to a bloodborne pathogen. And that's important to know where that's at, and then what your responsibility is for reporting if you should experience a significant exposure. So the occupational exposure to bloodborne pathogens from OSHA requires an infection exposure control plan, requires adequate education and training, requires hepatitis B vaccination for employees, requires the placement of personal protective equipment, requires methods of control, whether it be laundering facilities on site, whether it be sharps containers, red bags, those sort of things, requires housekeeping, stuff to clean up bloodborne spills and potentially infectious fluids from patients, requires a labeling with the red bags, and then a post-exposure evaluation with your medical provider and a follow-up should you suffer a significant exposure. Now, the Ryan White Care Act allows EMS providers to find out if they've been exposed to potentially life-threatening diseases while providing patient care. The medical officer within your organization would be responsible for requesting information about a particular patient, but only if you've had a significant exposure. So let's say that this patient have AIDS, and I don't know that, and I transport this patient to the hospital. If I didn't suffer a significant exposure, there's no legal obligation for the hospital to tell me that this patient had AIDS. But if I did suffer a significant exposure to their blood or body fluid, then they're obligated by law to tell me that that patient had AIDS or hepatitis or some sort of pathogen. There are two notification systems, the airborne disease exposure and the bloodborne or other infectious disease exposure plans. Once notified of an exposure, the employer has to refer you to your healthcare providers so that you can be evaluated and follow up, because you don't immediately get sick when you're exposed to these pathogens. Sometimes it can take up to 6 or 8 weeks before you even start to show symptoms. OSHA's respiratory standard, I believe it's 1910-134, deals with the selection and the use of respirators, whether they be N95 or HEPA masks, or whether they be things like Breathe Easies, PAPRs, APRs. A PAPR is a positive air purified respirator. An APR is an air purified respirators. Unlike an SCBA, these just force the air that's in a room through a set of filters and filters out all this bad stuff. When you're transporting a patient who is suspected of having TB or measles or Ebola or any of those things, you're going to have to be wearing personal protective equipment, whether it be an N95 or a HEPA mask, or whether it be a full chemical protective coveralls with a positive air purified respirator. Immunizations for hepatitis B and other infectious diseases should be available through your agencies. And some facilities, I know that we as a hospital employee, I'm required to have a TB test every other year to make certain that I've not contracted tuberculosis. All right, so that ends the section on well-being and safety, which leads us to the next part, which has to do with stress.